हेलो एवरीवन। आज का हमारा टॉपिक है ऑन्कोलॉजी। फर्स्टली वी विल टॉक अबाउट टर्मिनोलॉजी। ऑन्कोलॉजी वन मीन्स ट्यूमर और swelling and logos to study. That means branch of medicine dealing with tumor. Second terminology is tumor, an abnormal growth of body tissue. It may be benign or malignant. Third, benign. Growth that are encapsulated and remain localized. It cannot be spread to another organ. And fourth one is malignant. Growth that are not encapsulated and have ability to migrate. It can spread to another organ. Fifth one is neoplasm. Transfer of disease from one organ to another organ. Next, metastasis. Transfer of disease from one organ to another organ. And next is carcinoma. Tumor of epithelial tissue like skin, GIT, lung, urethra and breast. It accounts for 80 to 90% of all cancer. Carcinoma in situ. A lesion present with all the histological characteristics of malignancies except invasion beyond of basement membrane. Next is sarcoma. Neoplasm that originate from bone, muscle, fat and connective tissue. Next is staging, a method of classifying malignancies based on presence and extent of tumor. Next is lymphomas, neoplasm that originate from lymph node. Next is carcinogen, physical, chemical and biological stressor that causes neoplastic changes in normal cell. Next is undifferentiated cells that have lost the capacity of specialized function. Next is hypertrophy, increased size of organ due to increased size of cells. Hyperplasia, increased size of organ due to increased number of cells. Atrophy, decreased size of organ due to decreased size and number of cells. Next, metaplasia, conversion of one cell type to another or conversion of one type of tissue into another abnormal tissue. Anaplasia, loss of cellular structural and functional differentiation which is characteristic of malignancies. Next is adenocarcinoma, a malignant tumor arising from a glandular organ. Next is hemangioma, benign tumor composed of dilated blood vessels and often encapsulated within a fibrous shell. Echondromas, benign lobulated neoplasm of hyaline cartilage. Next is osteochondroma, a tumor composed of both cartilaginous and bony substance near growth plate of bone. Next is osteogenic sarcoma या osteosarcoma, most common primary cancer of bone, typically afflict adolescents. Hospice care, it is an interdisciplinary program of palliative like pain management and supportive services like terminally ill patients, for example cancer patient and their families. And last one is tumor marker, a substance whose presence in blood serum serve as a biochemical indicator for the possible presence of malignancy or progression and regression of tumor. For example, tumor marker and associated tumor. Tumor marker alpha fetoprotein AFP is associated with hepatocellular carcinoma HCC, testicular and ovarian cancer. Second one is beta HCG. This is associated with choriocarcinoma and testicular carcinoma. Next one, CA15-3 and carcinoembryonic antigen, that is CEA. This is associated with breast cancer. CA125, this is associated with ovarian cancer and endometriosis. Next one is CA19 to 9 and CA50, that is associated to pancreatic, gallbladder and colon cancer. PSA, prostate specific antigen, that is associated to prostate cancer. CEA, carcinoembryonic antigen, this is associated with colorectal, main lung and breast cancer. Benz-Jones protein, that is associated with multiple myeloma. CD19, 20, 22, 25, 30, 33 is associated with lymphoma. Next, beta-2 microglobulin. This is associated with chronic lymphocytic leukemia. And last one is calcitonin, that is associated with thyroid gland.